Dr. Khan, and coming to you on this fine Tuesday, March 17th. Just doing a lot of research on this coronavirus situation, and I just want to kind of let you know that I come across very interesting research, an article that's not really being talked about in the popular mainstream media. And one of the things that I see is a article published by the Journal of Orthomolecular Medicine by Dr. Andrew Saul. And what he reported here is that a Chinese medical team have reported a successful treatment of coronavirus patients with high dose of vitamin C. And this is coming from China in a press release posted on the hospital's website. The team described how patients suffering from severe coronary pneumonia, a potentially fatal complication of the new coronavirus, has recovered after being treated with high doses of vitamin C. Now, the medical team recommends that critically ill patients and those with severe neonatal pneumonia, vitamin C treatment should be initiated as soon as possible after admission to the hospital. And significantly, the press release acknowledged the early application of vitamin C have a strong antioxidant effect, reduced inflammatory response, and improved endothelial function. It also described how numerous studies have shown that dose of vitamin C used has a lot to do with the treatment effect, meaning high dose. The medical team said the past experience shows that high dose vitamin C can not only improve antiviral levels, but most importantly can prevent and treat acute lung injury and acute respiratory distress. So in the research, what they have done is that the dose recommended in the consensus in this research coming out of China is that they're using 50 to 100 milligram per kilogram of body weight per day. Okay, and for severe and critically ill patients, up to 200 milligrams per kilogram of body weight per day is advised. Now, this is using IV, intravenous injections. Now, you can still, use oral, and obviously, different forms of vitamin C and how you absorb it. Keep in mind that high doses of vitamin C can create gastric irritation. Some people get the loose stool and a diarrhea. But that's, you can tolerate that, meaning you can build up your dose, gradually building up to a higher dose to the point that you can tolerate it. Now, keep in mind, everything that I'm reporting here, just what I see coming out of China, and this is not necessarily a treatment or a cure for coronavirus, right? This is just for educational and informational purposes only. But extrapolating that information at 50 to 100 milligram per kilogram of body weight per day, if you take someone who's, let's just say, 150 pounds, or in my case, 160 pounds, I'm kind of a skinny Chinese dude. So 160 pounds divided by 2.2 gets you about 72.7, almost 73 kilogram. And then you multiply that by, let's say on the low end, 50 milligrams per kilogram. So for me, I would take about 3,600 milligram of vitamin C per day. Okay. Now, that's not crazy high, right? Your average vitamin C that you can buy out there typically is in the 500 milligram per capsule dose, might go up to 1,000 milligram per capsule. So you can easily reach 3,000 to 4,000 milligram, dosage. There are also some powdered and buffered vitamin C. A buffered vitamin C will give you less of that gastric irritation, so you can take a higher dose before you get some kind of loose stool. And then some of these things can, run up to a couple of thousand milligram in a scoop, in a powder form. So then you can really easily get up to 4,000 milligram, which will be the dose for someone who's 160 pounds, like me, right? Now, on the upper end, they say, up to 200 milligrams per kilogram body weight for someone who's, more severe or critically ill. Well, then you're talking a lot. So for, again, 160 or 160 pound person, that's me. That's about 72.7 kilogram. And if you multiply that by 200 milligrams per kilogram body weight, that's going to be about 15,000 milligrams of vitamin C. So that'll be more difficult to get from a oral source. So that's where IV vitamin injections for vitamin C will come in. But obviously they're doing that in the hospital, right, as a part of the critical treatment. And I'm suspecting that probably they're not doing only vitamin C. They're also managing them medically for other things using medication. So again, this is not saying vitamin C alone will cure this problem or solve the problem, but certainly for people with acute situations, it can help. Now, of course, vitamin C can help with immune function, right? Just as a overall wellness support, we all need vitamin C for proper immune function. We need vitamin C for collagen formation. We need vitamin C to help with, anti-inflammatory. It's an antioxidant as well, so it can scavenge free radicals. So on that note, vitamin C is something that you can take on a regular basis just for health and wellness purposes. The question is how much. So again, if you feel any type of symptoms, and I'm not talking about coronavirus here, right? I'm talking about any kind of virus. Because the way you fight any virus in the body is that you have to summon these Th1 helper cells or natural killer cells, and you have to summon Th2 antibody cells, cells that produce antibody, and there's a balance here. So the way you fight anything in the body, be it virus or bacteria or whatnot, is that you have to get the immune system to come online. And so there are various nutrients that can do that, and vitamin C is just one of many. So I'm not saying just vitamin C will solve all the problem. You want to take a holistic approach. And in the coming days, I'll be talking about individual ingredients, individual compounds and vitamins that may have some role in helping the immune system fight against various viruses. Again, not a treatment for coronavirus, but what you want to do, the principle here is that you want to get your body as healthy as possible. And that includes not just taking supplements, that includes a healthy diet, right? And that's why repeatedly you're seeing that people, not just elderly population, but those with high blood sugar, right? Their diabetes, they're more prone to coronavirus complications. Why? Because when you have diabetes, it's an inflammatory condition. Diabetes is not a blood sugar problem, it's an inflammatory problem. The high blood sugar causes so much inflammation, and that inflammation compromises the immune system and makes it more likely that these people with diabetes will succumb to the complications of coronavirus. So at the end of the day, don't worry about whether it's coronavirus or any other virus. Worry about how is your body going to fight any kind of virus, right? Because even during this time, you can still catch the regular flu, which we know it's just as deadly, if not more deadly than the coronavirus. So you have to guard yourself not just against coronavirus, but against anything else for that matter. And the way you do that is by improving your immune system function, which includes eating healthy, right? More vegetable to get the antioxidants, eating healthy fats, getting rid of processed food and sugar, exercising, and then supplements can come into play here. So vitamin C, again, 50 to 100 milligram per kilogram of body weight per day is the consensus coming out of China for helping to support people with coronavirus. So that's something that you may want to kind of just employ on your own just for general wellness. If you feel any sign of symptom like respiratory symptom or cough and flu, cold symptoms, whether it's coronavirus or not, you do the same thing. It's not like there's a separate thing for it. You're doing the same thing. So that's why it's great to latch onto that because there's things that you can do, right? It's not that it's hopeless or coronavirus, it's a novel virus, we haven't built up any antibody to it. True, but you can certainly get your immune system to kill anything by supporting it, by getting it in a better state. And that's what I recommend. So with that said, let's see here. I think, let me see if I can pull up. So do I sell vitamin C? No, Jay, I do not carry vitamin C. Much of the recommendation I'm going to make in the coming days, many of them are not stuff that I carry. And so the purpose of these is not to sell something. The purpose is just provide information so you guys can go and put this together yourself. Meaning you can find vitamin C in the store. I mean, it's a very common supplement. And if you ask me what brand specifically, I can't really give you any brand recommendation because there's so many different types out there. Obviously you want to buy the best possible quality supplement that you can. And so that's what you want to do. Okay. And Nicole asks, thank you for sharing. Great. Awesome. And Jackie, great. Thank you so much for joining me. And please share these videos, please. Only by information and by sharing can we get the message out. There's so much confusion out there. And again, I'm kind of standing, not on the sideline, but I don't want to get in the way of people doing what they need to do, meaning doing the hand washing, the social distancing. We got to be responsible, right? Because at the end of the day, we don't know how this thing's going to pan out. It can just end really quickly. By next week, it's all contained. Or it can drag out for a while. I mean, nobody really knows. So I don't want to be that person that's going to make a prediction. I don't have a prediction. All I can do is just support you guys with the best quality information. No BS. Some of the stuff I don't sell. I just want you to know so you can prepare yourself and go, you can purchase vitamin C out there. There's a lot of stuff that I'm going to tell you that I just simply don't carry, and that's totally fine. So that's what the purpose is, okay? So please share this video. Again, I'm Dr. Khan. Thank you for watching. And again, watch for coming days where every day I'll put out a content about specific nutritional or supplement compound or even lifestyle strategies that you can employ to help boost your immune system in this time of vigilance. Thank you so much. Take care.